So hamstrings themselves, I grew up on hamstrings as well, trained, with them and then used them for a long time. I have to confess that I'm sort of moving away from them now a little bit and using some other grafts. But the advantages, as Peter's already pointed out, are fairly well known. Small incision, the harvest was thought to be a little bit easier. And in later day ACL surgery, single tendon harvest has perhaps changed some of the biomechanics around the knee that we were worried about. I would point out that there is some disadvantages, particularly hamstring weakness and the possibility of irritating the saphenous nerve, which gives a little funny sensation on the front of the shin for a lot of patients. Peter suggested that size can be predictable. You get a small patient, small grafts, it fits in the notch. But actually, unlike some of the modern techniques that we use for BTB and quad harvest, where you pick your size and you're going to get that, with the hamstrings, you get what you're given. And there is obviously a slower incorporation time with soft tissue into bone. Some of the older studies suggested that hamstrings may stretch out the most, and some of that's been contested now, certainly with newer techniques of fixation and preparation. So on to the technical pearls, which is what this talk was really centered on. One of the things that I find very useful, particularly in patients where the surface anatomy is not that easy to define, or maybe you're just not familiar and when you're starting out, you just want to center your incision in the right place to make sure you're not going to make it too big or erroneously, is if you just mark 4 centimeters down from the plateau, and I stress the plateau, not the joint line, then you can center your incision on that. And roughly speaking, that will always bring you to the pes anserine area where the hamstring tendons can be located. You can make a longitudinal or an oblique incision. I have no preference. I'm a longitudinal person, and I don't actually inflate the tourniquet for hamstring retrieval. I find that it might grab the muscles a little bit and find the passage of the stripper a little bit more difficult. So I leave the tourniquet down, and the bleeding stops pretty quickly once you've got down to the hamstrings.